Thank you. I just want to take a moment, next slide, please, to welcome everybody to the call. My name is Julia Rojas, and I'm the Chief of the BHSA Policy Section at the Department of Healthcare Services. Also joining me in the presentation today is Teresa Christensen, the Chief of the BHSA Oversight Section. Today's session is focused on guiding you through several key topics involved in the process of completing the integrated plan template. Our goal is to provide additional information that may be helpful as you work through developing your integrated plan. Please note, this session will not cover the policy background or rationale for the questions included in the integrated plan. For all policy-related information, please refer to the County Behavioral Health Services Act Policy Manual. We encourage you to ask questions throughout the session using the Q&A box. We've also set aside time in designated sections of today's presentation to address any live questions you may have. Next slide. Our agenda includes reviewing important deadlines for the IP submission, discussing the IP budget template requirements, providing details on the care continuum inventory, discuss prudent reserve requirements, the process of redistributing unspent MHSA funds to BHSA, funding transfer and exemption requests, and the appeals process for them. By the end of today's session, you'll have a clear understanding of the IP process for these topics, the steps involved, and the resources available to support your submissions. The integrated plan submission timeline. So we've walked through this in the previous webinars, but for those who did not attend, I'll quickly walk through the IP submission process. The submission timeline is anchored by two key deadlines. The draft IP, those are for fiscal year 2026 to 2029, are due March 31st, 2026. And the second one is for the final IPs, which are due by June 30th, 2026. The draft IPs must include the budget, exemption, and transfer requests, and a letter from the county administrative officer and approval from the behavioral health director. Early and complete draft submissions are encouraged. DHCS will review submissions and will either accept the draft or request revisions within 30 days of receipt. We'll discuss requests for revisions in more detail in the next slide. Before submitting the final IP, counties must complete any requests for revisions, circulate the draft IP for a 30-day comment period, and the local behavioral health board must conduct a public hearing on the draft IP at the close of the 30-day comment period. The final submission must include approval from the behavioral health director and the board of supervisors. As previously stated, DHCS will review draft and final IPs for completeness and adherence to policy requirements prescribed in the policy manual and statute within 30 calendar days of submission. If we at the state deem that a submission does not address a question directly or is inaccurate, DHCS will contact the county through the county portal to rectify and resubmit the IP. DHCS will contact all the county primary and secondary contacts listed in the IP submission to rectify and resubmit the IP. If we request the county revise their draft IP, the county will have 15 calendar days from the revision notice to address the issues raised by DHCS and resubmit the IP through the county portal. DHCS then has 15 days to review and respond to the resubmission. So that's the integrated plan submission timeline. With that, I'll turn it over to Teresa to discuss the integrated plan budget.
Julia, I just want to make note, next slide, please, that DHCS has created several budget template trainings, such as an instruction manual and video walkthrough that are located on the BHT resources page on the DHCS website. And we're also including the links on the resources slide at the end of this presentation. This slide is just to cover some important notes to remember while completing the Care Continuum tab. The overall goal is to help counties consider all funding sources and service counties categories, promote transparency, and align planned expenditures with the projected number of individuals served. The budget template requires counties to plan for both BHSA and non-BHSA funding sources, ensuring a comprehensive approach to behavioral health budgeting. Counties must report both planned expenditures and the projected number of individuals served on the behavioral health care continuum. The care continuum framework is broader than just BHSA. It includes distinct categories for SUD and mental health services, allowing for more detailed planning and reporting. Other behavioral health activities such as workforce investment, capital infrastructure, quality and accountability, and administrative functions are excluded from the care continuum and must be reported separately in the Other County Expenditures tab. For each care continuum service category, counties must break out expenditures by age group, and housing intervention services are reported as a single aggregate total across both SUD and mental health frameworks in both the integrated plan, simplifying reporting for this category. So I'll turn it back over to Julia, and she'll just go over the care continuum inventory.
Teresa. As Teresa already touched on, the Care Continuum framework offers counties a structured approach to planning behavioral health services, allowing for thoughtful selection of programs that address local needs. The left column depicts the Care Continuum framework. Each county will identify which Care Continuum services they intend to offer for each upcoming fiscal year, along with estimates for both expenditures and the number of individuals who will benefit from each service. By projecting service delivery and associated costs, counties can better align resources with demand, support transparency in budgeting, and contribute to statewide data that informs future policy and funding decisions. DHCS will be providing counties with a Care Continuum inventory, which will serve as a detailed resource cataloging a variety of example services under each category of the Care Continuum framework. This inventory is designed to help counties better understand the full range of services they can consider when planning behavioral health programs for their communities. Although the use of the Care Continuum inventory is not required, it is strongly recommended as a valuable planning tool. Counties can use it to inform their care continuum projections, making it easier to estimate both expenditures and the number of individuals who may be served. This approach supports the BHT fiscal policy's emphasis on thoughtful service planning and transparent budgeting. The expected release date for the Care Continuum inventory is in September 2025. And by providing this resource well in advance, DHCS aims to give counties sufficient time to review the inventory and incorporate its guidance into their budget development and service planning for the next fiscal year. So this slide offers an example from the inventory showcasing how services are cataloged within the primary prevention services category. The primary prevention services category highlights efforts to educate and support individuals and communities before substance misuse or substance use disorders develop. This includes a range of services such as educational campaigns on topics like fentanyls or adverse childhood experiences, preventative alcohol and drug treatment services, harm reduction education, naloxone training, distribution, and targeted prevention activities like screening and referrals. If you look at the service category definition at the end, examples of funding for these services are provided. Funding can come from various sources, including the Sub-G Prevention Set-Aside, SAMHSA, PATH Block Grant, Opioid Settlement Funds, and 2011 realignment. This is just a sample, but this is what each row would look like. Next slide. Our first question slide.
All right, we have a hand from Amanda Greenberg. Hey, well, thank you for this. I am wondering if this continuum planning tool and the integrated plan are going to um, get rid of some of the duplicative reporting requirements that we have for the substance use block grant as one example, since you used that as the example.
And I'm sorry, are you saying is by submitting the integrated plan, are you going to no longer be required to submit for other programs?
So you just use sub-G as an example. So sub-G itself has requirements to report into whatever the new PPSDS system is, ECHO maybe. And then, we have to do the application every 2 years that has its own reporting and outcomes requirements. And then every 5 years, we have to do the strategic prevention plan. So are some of those requirements going to go away with the new integrated plan and this continuum of care tool?
I don't believe that there's going to be an impact to other programs, but that's something that we can take back and look into specifically and get back to you on.
Okay, I mean, I guess as a recommendation from a small county, and it would be really nice to not have to do all the extra sub-G reporting now that we'll be reporting it in the integrated plan.
Thank you.
Not showing any additional hands right now. All right, I think we're good to move on.
And so next we'll be talking about the prudent reserve. Next slide, please. Counties are allowed to use local BHSF money to fund their local prudent reserve, which they are required to establish and maintain to ensure BHSA programs and services are not significantly impacted in years in which revenues are below recent average. Prudent reserve transfer funds can be spent on FSP services, HI programs, with the exception of capital development projects, and programs in the BHSS category, such as the children's system of care, the adult and older adult system of care, and outreach and engagement activities. When counties transfer funds between their prudent reserve and the BHSA components, these transactions must be clearly reported in both the IP and the IP budget. Each BHSA component tab within the budget includes a dedicated transfer section. Counties are required to report the estimated amount of transfers for each fiscal year in these sections. You'll see an example of if a county transfers, say, $10,000 out of the prudent reserve to BHSS each fiscal year, this amount should be listed in the appropriate transfer section of the budget. Counties must assess the prudent reserve every 3 years and include the assessment in the IP. This process helps counties review whether their reserve levels align with state guidance. If a county's prudent reserve balance is higher than the maximum allowed, the county is required to report how the excess funds will be reallocated to the BHSA components. This reporting is required to be included in the IP and budget, and counties are required to transfer any prudent reserve funds that are above the maximum amount. DHCS will continue to provide counties with the maximum allowable prudent reserve annually for the assessment. DHCS calculates the maximum allowable prudent reserve for each county by taking the average of the total funds distributed to that county over the previous 5 years. Large counties, the prudent reserve cannot exceed more than 20% of the 5-year average, and small counties, it's 25%. These limits are designed to help counties maintain appropriate reserve while making the majority of funds available for behavioral health programs and services. Counties with prudent reserve balances above the maximum must describe in their IP how excess funds will be redistributed to the BHSA components. The IP must include a written explanation of which programs or services will receive the excess funds, how these decisions address community needs, and behavioral health goals for the specific dollar amounts to be transferred. For the 26-29 IP, counties have local discretion on how to allocate these one-time excess funds and may exclude them from the standard component funding allocations, as long as all transfers are clearly reported and justified in the IP and the budget. When a county's prudent reserve balance is higher than the maximum allowed, the excess amount must be redistributed to eligible components under BHSA. This table is just an example of how the county might choose to redistribute those funds and report it in the IP budget. Do we have any questions?
We've got a hand from Natalia.
Hi. If a county has unspent funds in a category from the previous year that are not in the prudent reserve, but for instance, if a county had excess funds in their CSS and those are now being redistributed into new categories, how do we report on that? That they're not funds that are in the PR, but are still excess funds we're redistributing.
I know what you're talking about. So I'm going to talk about unspent MHS funds to BHS funds next, but for that,
Okay, cool.
you can transfer any unspent funds. You can transfer those into the prudent reserve as long as you are not over the maximum allocation for your county.
Okay,
So
thank
you
you.
can do that with unspent, and you would do that and report that in the IP budget.
Okay, thanks.
All right, here from Jalpa.
Hi there. I don't know if I missed this in the prior presentations or webinars, but I have a question on how the prudent reserve maximum amount is going to be calculated by DHCS. In the past, it was the maximum total funds distributed to the county over the previous 5 years, 5 fiscal years for CSS funds. And now with this BHSA new categories, is it going to be from the top, or is it going to be certain categories amount that will be used to calculate the 25% for the smaller county and the 20% for the larger counties?
It's the total amount allocated. It's not distinguished by a certain component.
Okay.
And it includes all reallocated funds too. So if there were funds subject to reversion that were reallocated, those are included as well. And just to note too, we are going to be posting the amounts for the counties soon. That's probably a question, but we're working on getting those posted so counties have it.
Thank you.
You're welcome.
I'm not showing any additional hands, but we did have a couple that popped up in the chat that I can share. From Raven asked, when will DHCS provide counties with their PR maximum amount?
We are working on getting that posted. So it'll be posted. I'm not sure where exactly, either on like the downloadable resources page under BHSA, like where the policy manual is. That's where I think it's going to go. And when it is posted, it'll be announced through the behavioral health e-blast that goes out weekly.
Perfect, thank you. One other from Raven, will the PR excess funds be counted towards the county's 30% housing interventions, 35% FSP, and 35% BHSS allocations?
No, for the excess amount, counties have local discretion on how they would like to allocate those funds. And they don't have to adhere to the component requirements.
Perfect. I think those are the only ones in chat that we're not already working on. So I think we can move on.
Okay, thank you. So the next section, we're going to be talking about redistributing unspent MHSA funds to BHSA. So starting July 1, 2026, counties may redistribute any unspent MHSA funds to components under BHSA. Counties have the flexibility to decide how these unspent funds are reallocated among the available BHSA components. All reallocations must be reported in the IP budget. In the IP budget, reallocation of MHSA funds to BHSA components are excluded from the required component percentage allocations. Due to the reversion timeframe specific to WET and CFTN, these funds must be reallocated only to BHSS and cannot be transferred to FSP and HI. This slide shows an example of how a county can redistribute unspent MHSA funds to the BHSA components within the IP budget. The table lists the available unspent MHSA funds from MHSA components. And then the table also displays how the MHSA funds are reallocated to the BHSA components. You can go to the next slide. Counties may continue any previously approved operational in projects through the first IP cycle. A project is considered operational if it has incurred expenditures prior to July 1, 2026. If the in project is not operational, as a note in dollars have been spent, then those in funds may be subject to reversion. All operational projects must conclude by July 1, 2029.
There was a request to repeat from Priya regarding unspent MHSA funds not going to FSP or housing interventions.
Just for WET and CFTN. So if you have MHSA, WET, and CFTN funds, because of the reversion requirements is 10 years, those funds have to stay under BHSS towards the WET and CFTN programs. But CSS, PI, and innovation, those you can allocate those funds however you'd like.
Perfect. I'm not showing any hands at this time. Oh,
Okay.
you got one from Raven now.
Oh, okay.
Hi, Teresa. Can you hear me okay?
Yeah. Hi, Raven. How are you?
Good. Good to see you on here.
Thanks.
Just a quick question around, and I know we have talked about this a little bit through emails, but just so counties hear it as well. But when counties are, we've got those allocations, the 30%, 35%, and 35% that counties, are supposed to be allocating their BHSA dollars to. When counties are rolling over their unspent funds and or if they have excess prudent reserve that they're rolling into the BHSA, can you talk a little bit about how, like, whether those unspent dollars that roll into BHSA, whether that gets calculated as part of the 30%, 35, and 35? I know that it's counties can distribute those dollars into any of the buckets, but what I'm looking more for an answer around is how the 30, 35, and 35 is calculated in the template, in the budget template.
Yeah. So the 30, 35, 35 is calculated based off projected revenue. I honestly do not know how counties currently do it for MHSA. But for BHSA, you would determine what the projected revenue is for the 3 years to determine your 30, 35, 35% allocation percentages.
And then just to be a little bit more precise here, that's for the new revenues that are coming in.
Correct.
And so when they have their unspent dollars or their prudent reserve dollars that are rolling over, that doesn't get included in that allocation percentage.
No,
okay, great.
It does not, because we wanted to allow counties flexibility in how they redistribute their unspent and excess funds to determine where it's most needed at the local level.
Great. Thank you.
You're welcome.
All right, we have a hand from Amanda.
Thank you all. I'd like to piggyback off of Raven's question. Thanks, Raven, for kind of diving down into that. One of the things that we've been discussing in Mono County has been our WET and CFTN allocations, especially our WET allocation. And so my understanding, I'm hoping that you can confirm or deny, is that let's pretend that we have $100,000 of unspent funds and we decide we want to put it all into BHSS looking forward. does that mean that the funding there still has to, it's still subject to the early intervention 51% requirement?
Yes, I believe
Okay.
so.
And if we, in our 25-26 annual update, if we set aside money in wet longer term, can we get to transfer that we get to keep that in wet as we look forward? Is that also correct?
Yes, yeah, because anything that's MHSA in wet or CFTN, because of the reversion requirements are not changing under BHSA, so counties would still have the 10 years to spend those funds.
Okay, but they're not subject to the percentage issue.
I believe that they are. I might have to get back to you on that just to double check since I don't have the policy manual in front of me, but I believe that everything in those buckets is subject to the step allocation requirements, but we can come back with that.
Okay, that would be great, because I was
Yeah.
under the impression that if we had if we had a wet plan that was looking forward and we had encumbered that money in wet for 10 years now, that we would be able to keep that money set aside in wet under BHSS.
Yeah.
So I'd really appreciate that. And then my question then is, if we can set aside the money in wet looking forward into BHSA and the first IP, can we take our prudent reserve excess and put it specifically to wet looking forward?
Okay, I'll take that one back too and just double
Thank
check.
you.
You're welcome. Thank you for the questions.
We've got one question in the chat that I wanted to raise up that was related to funds from MHSA being reallocated to the QA admin bucket, and if that's allowed through innovative projects.
QA admin bucket. I might have to take that one back too, just to look into that one a little bit more. I don't know off the top of my head.
Perfect, thank you. And that is all the hands that we have raised right now as well.
Okay, thank you. So next we're going to move on to funding transfer and exemptions request. So just a reminder, counties are required to submit all funding and or exemption requests with the draft integrated plan. This allows all related documents are reviewed together, and then communication from DHCS with counties regarding transfer and exemptions requests will be communicated through the county portal. So next slide, please. Counties may request changes to their BHSA funding allocations to better address local priorities. Funding transfers are capped. No more than 7% can be moved to or from any single component, and the total amount transferred across all components in a fiscal year cannot exceed 14%. Counties must provide a clear justification for each transfer request, explaining how the change will better meet community needs. Counties may also choose different transfer amounts each year. However, once the transfer request is submitted for an IP cycle, it cannot be changed until the next IP cycle begins. On the IP budget, there are built-in validation checks to ensure percentages entered are allowable. Just wanted to flag that. Up to 7% of HI funds can be used for outreach and engagement. If counties opt to allocate HI funds for outreach and engagement, the amount of funds available to transfer to other components must be decreased by that amount. For example, if 3% of HI funds are dedicated to outreach and engagement, then only 4% may be transferred from HI to FSP or BHSS. Counties must track and report these allocation and transfers in their IP and IP budget. Counties are required to report the proposed dollar amount transferring into and out of each component for all available fiscal years in the IP. This means for one transfer, the amount will be entered twice. And then for the 26-29 IP, small counties that are requesting exemption for the 30% allocation for housing interventions should assume approval and complete the funding transfer tables based on the exemption. Any questions about funding transfer requests?
All right, we have a hand from Amanda.
Hi, it's me again. Could you go back a slide by chance? I'm curious about the small county piece. So so Mono's a small county. We're a tiny county, in fact. Let's pretend that we exempted all of the housing intervention money. So we need to transfer 30% out. How does that
Mhm.
work with the 14% and 7% rules that you were mentioning before?
It would be excluded from that.
It would be really helpful if you all could specify in the policy manual and other guidance where rules don't apply to small counties. So like on the previous slide, if you all could say, rather than like all counties are subject to this requirement, like have an asterisk, like except for small counties who request X on the housing exemptions.
Okay, we can take that back. Thank you.
We've got a hand from Raven.
One quick follow-up on Amanda's question. So if a small county requests an exemption of, let's say, 30% in the housing component, or no, let's say they requested an exemption to reduce the housing intervention bucket from 30% to 20%. Could they still use a portion of the funds that are left in their housing intervention bucket towards outreach and engagement? Because I know there's that 7% max in outreach and engagement for housing intervention, but that's tied to transfers between the buckets. How does that apply if a county has been granted an exemption for a percentage reduction in their housing intervention bucket, where it's not the whole thing that they're requesting exemption for, but just to reduce the bucket by a certain percentage?
I believe that we're going to talk about exemptions next, so we can get more detail about that too. But I believe that they would transfer the 10% then to either FSP or BHSA and BHSS, and then they would be allowed to use still that 7% towards outreach and engagement.
Great, thank you.
Mm-hmm.
No additional hands currently.
Okay, I'm going to pass it back to Julia to talk a little bit about housing exemptions.
Thanks, Teresa. So just like with transfers, eligible counties must submit exemption requests through the county portal as part of the draft integrated plan by March 31st. For fiscal years 2026 to 2029, all counties are exempt from the requirement to provide full service partnership evidence-based practices to Fidelity. In fiscal years 2029 to 2032, only small counties will be permitted to request a full service partnership exemption. For fiscal years 2026 to 2029, only small counties may request a housing interventions exemption. All counties may begin submitting housing intervention exemption requests, starting with fiscal years 2032 to 2035. So, because the FSP exemption applies automatically to everyone this first cycle, we'll focus on the housing exemption request process. So counties may request exemptions from one or more spending requirements for housing interventions. The first exemption is from the requirement to spend at least 30% of BHSA funding allocations on housing intervention services. The second exemption is from the requirement to spend at least 50% of housing intervention funds on individuals who are chronically homeless. The third exemption is from the requirement that no more than 25% of housing intervention funds may be used for capital development projects. And counties may request more than one exemption at a time. So counties may request an exemption to adjust the required 30% allocation for housing interventions beyond the 7% funding transfer limit. For 26-29 integrated plan, only small counties are eligible to submit all of these exemption requests and require approval from DHCS. To reduce the housing interventions allocation, counties must demonstrate either that there is a very limited need for housing interventions, or must show that sufficient funding is available from other sources, or present some other compelling local considerations. Counties must support their request with relevant data and documentation. To increase housing intervention allocations, counties must demonstrate that either there is a very significant need for housing interventions, show that there is insufficient funding from other sources, or present other relevant local considerations. I'll go through an example of how to submit a request in the following slides. So in this example, the county is requesting to decrease the housing interventions allocation by 10%, moving from the required 30% base allocation down to 20%, and reallocating those funds to BHSS. And just as a reminder, when completing the integrated plan funding transfer tables Teresa mentioned earlier, the county should assume the exemption request is approved and reflect both the decrease in housing interventions and the corresponding increase in BHSS as a starting point. So for question 1A, in this example, the county's response in the integrated plan should indicate that 20% of funds are being utilized for the housing intervention. For question 1B, the county should indicate that 10% of funds from housing interventions would be reallocated to BHSS, reflecting the decrease from the required 30% allocation. No funds are being transferred to or from FSP components, so its allocation would remain at 0%. For 1C, the county must identify which exemption criteria they are using to justify the request to decrease the housing interventions allocation. In this example, the county selects Roman numeral I, very significant or limited need. For question 1D, the county will need to provide a written response that clearly explains the rationale for decreasing housing intervention funding and increasing behavioral health services and supports. Since the county in this example selected very limited need as the criteria for the request, clear rationale must be provided. Some examples of a clear rationale might be stakeholder engagement findings that demonstrate that community members and service providers support the proposed change, or maybe that the exemption will address gaps in behavioral health services while maintaining adequate support for housing interventions. Or it could be that the exemption aligns with current community needs and does not compromise housing services. The response must reference the relevant data sources, such as the point in time count that this example selects, that were used to determine that there is a very limited need. Evidence from additional sources, including the claims data or coordinated entry system data, housing inventory count, HMIS data. These can all you can select more than one, and those can also be used to substantiate the request. So the second type of housing intervention exemption available to small counties would be to reduce the required 50% allocation of housing intervention funds for chronically homeless individuals. The county would follow the same process we just went through, identifying the applicable criteria, such as that there is a very limited need, there's sufficient funding from other sources to meet the needs of this population, or present other considerations. And they would provide a narrative justification tied to the identified criteria, incorporate the data used to determine that a request for an exemption is appropriate, and lastly, include any other documentation that would support the request. We won't go through all 1A, 1B, 1D. We won't do that each time, but it's the same looking process. So the third exemption that small counties may request is an exemption to exceed the 25% limit of housing intervention funds allocated for capital development. Exemption requests can be made when there's a significant need for capital development to meet the housing needs of the eligible population, particularly if there's a demonstrated lack of existing suitable housing facilities within the county. Other funding sources are insufficient to address the housing needs, or the costs of accessibility improvements exceed the 25% capital improvement limits, or for other considerations. Requests for capital development exemptions must follow the same process as above, indicate the criteria that applies, provide a narrative justification, incorporate the data used to determine that the request is appropriate, and provide any additional documentation that would support a request for an exemption. Data that counties can provide that would support an approval could be a detailed budget with a funding breakdown, or partnership agreements, or letters of support, or evidence of the need for housing production. Counties can upload as many documents as needed to justify an exemption. So appeals for transfer and exemptions. Okay, to really hit this home, counties must submit funding transfer and exemption requests with their draft integrated plan by the March 31st deadline. DHCS will review these requests and respond within 30 days of receipt. If a request is denied, DHCS will communicate the decision through the county portal and send a letter of denial. Counties have the option to appeal denials within 30 days of receiving the denial notice. Whether or not a county pursues an appeal, updated IPs are still due by June 30th. This next slide is a visual of the timeline, assuming the longest amount of time is taken at every stage. You'll see that there's a first, March 31st, counties must submit their draft IP transferring exemptions requests. DHCS will review and respond within 30 days. DHCS denies the exemption request. Counties have 30 days, 30 days to submit an appeal. DHCS may request additional documentation from the county within 10 calendar days of receipt of the appeal. And counties must supply the requested documentation within 10 days of DHCS's request. DHCS will review any additional documentation submitted and approve or deny the appeal within 10 calendar days of receipt. And if the appeal is denied, counties must update their IP to reflect the denied exemption by June 30th. Questions?
While we wait for hands raised, we got one in the chat. Julia asks, do counties have to make a request if they choose to not use 25% on capital development?
No. The 25 cap is a top limit. And so if you use less, that's within the limitations of the plan.
Perfect, thank you. And then we have a hand from Amanda.
Hi, you all. Would you mind going back to the slide that talks about the FSP exemptions?
If one of our speakers could guide me to which slide that is.
You mention it right after it's the first slide in the exemption requests section.
Slide 36. Yes, this one.
All right, great, thank you. Okay. So could you all clarify, please, the requirement for small counties in the first IP? With respect to the FSP EBPs?
So, in case it's helpful, the full service partnership exemption is just from EBP fidelity requirements.
All right.
So
I'm
the
wondering
requirement to
if-
provide FSP in accordance with the manual is still, that counties will continue to be required to provide full service partnership.
Well, of course, we're still required to provide full service partnership, but it's the implementation of the EBPs that I'm concerned about. I'm curious how DHCS got from the bill language, which states that counties with a population of less than 200,000 will be able to submit a request for exemption from the EBPs, to small counties have to do the EBPs, just not to fidelity. Is someone able to speak to that a little more?
I, so your issue is with providing EBPs at all?
That's correct. Yeah, I've been doing a really great deep dive this week into the EBP policy guide that was released in relationship with BH Connect. And even looking at the requirements for Act and Fact, it seems like such an amazing program. The requirement is that you've got like 10 FTE team employees who are clinical employees, a discipline and interdisciplinary team whose only job is to do ACT, and they serve 80 to 100 individuals who qualify for ACT. Mono County only has 12,000 people, so there's absolutely no way that we would be able to implement FACT anywhere to fidelity. And frankly, in my opinion, it's pointless to even try. And so then that cascades into these odd questions about how do we do the budget template, even if we work with the centers of excellence to, work towards, I don't know, some semblance of fidelity. How do we budget for that, knowing that we're never going to be able to do it? And why even waste the money trying?
Yeah, I think I don't want to sidetrack too much of this training, but I do absolutely understand. If you could, first of all, if you could send a prompt to the BHT inbox, I think we can provide additional guidance, especially for your situation.
Oh, well, I know there are a lot of other small counties who'd be really interested in this information too. There's a small county gathering that happens a couple times a month, and this was a big topic of conversation at our last meeting.
Got it. Okay. Yeah, we'll take that back and provide some guidance to small counties. I think the highlight in this is that is the EBP fidelity requirements are not going to be applicable for this first IP. However, we do have a process that we're working on with what the how counties are going to work with COEs. That'll be available soon for review. And so we definitely will have more information coming, but I appreciate you sharing the concern and that it's also happening in other areas. And so we'll take that back and get some guidance out.
Thanks, Julia. I appreciate it.
All right, as of right now, we don't have any hands or any open questions.
So we can go to the next slide. As far as the next steps, the next module releases will be related to compliance, oversight, and monitoring. More details on the annual and intermittent updates and the correlation to the behavioral health outcomes accountability and training report template, or the BODER as we've started lovingly referring to it. Be on the lookout for details on the next public comment period to provide feedback before the policy manual is updated with finalized changes. Content from today's session will be shared, and we'll share where the previous decks can be found.
Julia, we have a request to return to the innovation projects slide. Diane, if you can raise your hand and we can bring you up, you mute, you might be able to help guide us to that particular slide that you're referring to. Perfect. Should be able to unmute now.
Hello?
Yep, we can hear you.
Me? Okay, awesome. Hi, Diane Higginbotham with Tulare County. I was just wondering if you could just go over the innovation funding and the reversion kind of language again.
So if your county has an approved in project that the OAC approved, we're allowing counties to continue those in projects through the fiscal year 2029. However, they just need to be operational. So if your county's already just needs to spend some sort of dollar amount in fiscal year 25, 26 for it to be considered operational. If you do not have any operational in projects, they may be subject to reversion, those funds, just depending on if the time frame to spend has passed. Because encumbered in funds, there's a lot of older dollars in encumbered in funds.
So those would revert back to state or not, but not be, we can't roll them over, I guess is my question.
If the reversion period has not passed, you can roll them over. If the reversion period has passed, then you cannot.
Okay, thank you.
You're welcome.
All right, and no additional hands right now. Was this the final slide?
I believe so.
Okay. A couple of questions in the chat. First is, where do you report the planned MHSA INN expenditures on active projects in the budget template?
So those we're just requesting that counties report them in the BHSA component tab that the project most aligns with.
Perfect. Another question regarding the reversion period that you were just discussing, is that the original reversion period or the plan reversion?
The original reversion period. So whenever those funds were deposited from the SCO to the county.
Perfect. Last question here. Let's see. If an INN is split between housing and DHSS, do you split the INN cost between the two components?
Yes, you can, I believe you can do that for the budget. We'll use whatever's reported in the voter and the RER to spend down encumbered in funds. We'll just base it on actuals.
Perfect. And I think I've got the other question that I can answer. Do we have any additional slides?
No, that's the last one. We do have an appendix for when this is going to be shared that has some links, helpful links and to resources. But that's it.
We've got a hand from Courtney.
Hey, sorry, I'm actually Hillary. Courtney's my boss from Ventura County. Can I just get a little more clarity on the innovation reversion question? We have one innovation project where the dollars are old and would have already been expired if we choose not to maintain it through the allowable period under BHSA. Are you saying if we decide not to pursue or not to keep that program, those dollars would already be going back to the state?
Possibly.
Okay, just to clarify.
Encumbered funds is much different than actual funds. So we encumber the funds to save them from reversion and keep them with the in project. But we use actual expenditures reported on the ARER or soon to be the voter to spend down those funds. So it's kind of hard to say,
Okay.
Exactly what it would look like without having actual expenditure data in front of us.
Okay, can we send that as like a follow-up to the BHT email to try to understand what the risk would be? Or is that like how?
Yeah, and you could also,
Okay.
your reversion enclosures, they explain the spend down of encumbered funds and your innovation funds. So you could kind of see where you are in terms of encumbered funds and unspent innovation funds.
Okay,
But you can send follow-up questions to that if you have them, and we can help you with that.
thanks.
All right, no additional hands at this time. All right, now I got a hand from Bria.
Hi, sorry if this has already been addressed. So if we are rolling over an innovation project with encumbered funds, so for example, for a small county, we have 5 years to spend the funds, not 3 years.
Correct.
Does that time frame still extend, even if we're going to be kind of reallocating the innovation into one of the BHSS components? Does that 5-year spend down time frame carry over?
Yeah, reversion time period has not changed. So small
Awesome.
counties have 5 years, large counties have 3 years. Yeah.
Thank you so much.
You're welcome.
All right, no additional hands. All right, Amanda.
Thank you all. Since we have some extra time, or it appears that there's a lag in hands, is it possible to ask other BHSA related questions, or you will really need to stay on the topic of the webinar today?
We can try. We're kind of specific to what's in the training, but we can try.
Okay, thanks, Teresa. I appreciate it. I totally get it if you all can't answer a question or need to take it back. But there's been a fair bit that's been buzzing around in my head the last bit of time. I've been looking into some of the bundled rates for high fidelity wrap, ACT, and IPS. And I'm curious, if as a small county, we're required to try to do ACT and IPS, do we have to be at fidelity to get the bundled rate?
I don't know that I want to necessarily speak to the because you're talking about the Beach Connect.
Well, I mean, I suppose I am, but I mean, the programs are required under BHSA.
Right. I think that's something that we'll need to take back, but we can definitely find out some information that we can share.
Okay. Yeah, I've got a handful of questions that relate to BH Connect and the fidelity requirements, and whether we can get the incentives for the BH Connect EBPs if we do have to implement them under BHSA, but if we don't implement them to fidelity, do we still get the incentives? Like some of the pieces like that, where I'm starting to put some of that together, feels really tricky to me. Let's see, the other one I sent over to you all, and I'm still not totally clear on the answer, is around the early intervention. So let's see, county EI programs must include all the required components, so access, outreach, and treatment. There are different places in the template and the policy manual where it's unclear if each EI program must include all three components, outreach, access, and treatment, or whether the county as a whole under EI must just have those three components and they can be in three different programs. Could you all provide some clarity there?
Yeah, I think it's what use of program are we at any given time? I think what you're asking about, as long as all of the components are addressed in the county, multiple providers can be used to address. Does that make sense? So
So in Mono County, we don't have any providers. It's just us. So just as a reminder for the small county differences. But so if I have one program that's focused on early intervention, outreach, and access, and then I have another program separate that's early intervention treatment, that meets the requirements.
yes.
Thank you very much.
We've got a hand from Courtney.
Hey, you may have gotten this question from somebody else already, but we have been struggling with how to set up our programs in the IP. And the example that I think we've used a couple times are our clinics. We have 6 outpatient adult clinics that all use or will use BHSA funding. And we're trying to figure out if we would be required to report that service 6 times in the IP, or whether that would be one program, outpatient clinic services, and note in the description that there are 6 different geographic locations. Do you have any feedback there? I think we've taken this question via your inbox as well, so we can be patient, but if you have any advice, it would be great.
And hard for me to visualize. And so if we're working on it through the inbox, I don't want to you know, like kind of skew what thoughtfulness it is, but we'll make sure we're coordinating with the whoever's addressing the issue so that we can kind of figure out a straight path for you.
Okay, great. I think we've given a couple examples of that via CBHTA and a couple others. So we'll be patient, but I appreciate it.
Thank you.
All right, we have no additional hands and no questions in the chat.